And then people that are involved.
I got the whole one, yeah.
No, I'm gonna make marks
Just
on there.
picking the, yeah, I'm just
Okay,
picking
goal,
the
with some holes involved.
I'm about to pull the plug on all of my life path
I was in full of chat.
and force the
I'll put down
connection
chat.
between the phones.
Yeah, that's not good.
That's not family.
Well, it's not keep moving.
That's the first step in getting rid of the hole.
What do you want?
The thing is, I need that like connection still for import utility, which is all.
What does you
Reset.
want
But
full
yeah,
screen?
We
I
added
know.
the cellular modems to all of
You
our
hit
X series.
a lot
So at
of
least we can,
for
without having to do
control.
it Bluetooth only, it just sends the, whether it's going to the Pulsar.
So flip the chat box
Or it's sent, closes the gates out, or just like
Yeah.
small little 5G modems.
so,
It's weird. They changed everything.
oh, they're not the modems that came, not the light path modems that we all had.
Just go to
So it's all has USB port inside, you attach a
Oh, that's right, you have the, right,
USB
you have the
motor to
different.
it, and it's funny, the 5G modem.
Here's your list of
plans
who's,
are actually cheaper than anything else.
Yeah. There might be several people at.
They're
That's what I, for voting, I get the ones that are at the remote.
That's
not.
exactly the.
No,
I'm gonna
remote
save-
site drop.
I'm gonna save hundreds of dollars every month.
Okay.
no, it's let the park half minutes, but you can't tell who's there.
We'll get a. Online versus remote site.
See if you didn't pin.
Our bids come out today. Dale, that's the day it's in the area.
Don't know why.
And you can see it. Who's that?
Can you lose the other? Your 11?
It was Brian Terry.
Oh,
Dale. Dan Murray. I was the other ones about her.
it's coming by tomorrow.
No, that's hiding.
I'm not
gonna try.
There was some concerns, so we had both, and initially
I'm sorry.
I was doing a survey. And
I
they
don't-
had to decide what they liked. The problem is.
Maria, right?
So Physio came by, dropped off 2:30.
Yeah.
Just texted me, sign up.
Okay, Congero's there too.
Soul's not in a point they can do that yet because the.
We got, let's put the park online.
So.
Carol will tell you in a
He
minute.
came by with one and rode around with the supervisor, I think 2 different days, but people didn't
Yeah,
get
Congero.
but it wasn't his first time. You know, so, and it wasn't FDA approved at the time. So he could
Scotia's
just
on.
leave it and use it.
Let's go show once. Yes.
I'm all set. I'm on.
I just got off the phone with Jeremiah, had a problem, I had to reset the link.
Well, now we can't hear
Thank
you.
Yeah, Chris Holmes, oh, and down.
We cannot hear you,
Do on the home screen, touch screen.
Jeremiah.
Where the light, the 35, you kind of gotta dig in a little bit, the different pages and whatnot. I don't dislike.
Can you hear me now?
Half of them.
And
I feel like it's on
Especially
already.
when you get lost all day every day. But
So they gotta turn it off.
It's ridiculous.
I've heard it's like.
Can you hear me now?
It is like, it's very late. It's definitely.
Cafe.
Very thought.
Oh, that was the, retarded frustrating.
He was a striker.
He's had his civilian job now, is he or
So
put away from
Well,
his
14.
technical job.
Are you guys able to hear me?
Flight deck trainings and. It's, yeah, most positives that you don't turn on.
If you show up, you.
It's so facilities that is actually.
Yeah, so I show up, your battery, it's a huge, it's not.
Every time connected battery just in them.
Right, like there's.
Excellent reasons. We've
Or jump on.
Yeah. I'm excited. Get all about 7 He piggybacks off my head. They write them in so that we can.
hearing.
So, yeah.
Okay, so they-
It's always like that.
It said 10 talking.
Yeah, it knows that.
This is all building. Yeah, it's.
Shannon can hear during.
Okay.
See that, and they'll hopefully.
You guys able to hear me now?
So,
Yes. Check with them, right?
Our sound's not. Gotta go to the sound. Over.
we shall see.
Down.
Here.
Hopefully they're on my email before I leave here. If it's Thursday, we're supposed to have Friday, and then Friday, so there's no holiday. We just started. But you. You know, I think they're going to get a few, you know. I think the heroes go out. That'll go down. So I actually don't know if the game's being afraid, but I can't see it. So, okay.
Let's say we have up, we just have call.
Did you have social on these?
Jeremiah, can you try talking again?
Is he on remote?
Yeah.
Can you hear me now?
Yes.
There we go. Perfect. Doc Daly's here.
So Jeremiah.
Let's meet back to the number. I didn't know.
Now.
There'd be the counter.
If I have my fear. We got this. This also sucks here. You're good? Good. You want to life, you want to vote, and then these are the old, thank you. Immaculate, somebody told me, bracket, that's it, we'll do it. So, we'll say that. Anybody need an agenda? Yeah.
You got me next one.
Yep. Oh, wait, oh, certain, what do you need? No, yeah, I'm not, we don't, you got the number? Okay, well, install the meeting to you, item 7 will be on the pledge list. Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So we're gonna, because there's a conflict with a different meeting, we may lose people to attend that meeting. We're gonna adjust our agenda to accomplish a couple of votes that are important to do when we actually have a physical vote. So the first one is we're gonna acknowledge Robbie McHugh, who's here today as an alternate for Olympia County. So if somebody wants to make a motion to accept him as an Albany County alternative. From Bloom, second by Charles. All those in favor? Anyone wanting to vote no or abstain? Don't see it. Very good. Thank you, Rob. The next one is Northern Duchess and Empress Ambulance Service. That represents Empress Purchasing, for lack of a better description, Northern Duchess paramedics. There is a small portion of the Northern Duchess operating territories that involves extreme southwestern Columbia County. So that's why we have that before us. Obviously, a similar action is occurring with the Remsco to the south of us. But anyways, we have to vote as it relates to that portion of their operating authority. There is no change in that operating authority territory. It's simply moving forward with the transfer because of the transfer of ownership. So we reviewed their application, found it to be complete, sent DOH a request that they would do the fitness and competency review, which they did, and replied back to us that there was no bar to that. So the motion presented to the group for adoption would be to accept the findings of the New York State Department of Health that there is no bar to that transfer. And we would essentially be voting to approve the transfer as I just described. So with that, it's actually a roll call vote, and I have Carol do it.
Can we hold on for
Yep.
1 second, sir? We're getting Greenport online right now. Are you on Greenport?
Good morning. Greenport is with you, and we have Steve Meehan, Anon, and myself.
Yeah, can I turn on? And again, who's not? Greenport, can you please turn your thank you.
All right, I think we're good now, right?
We can see their smiling faces.
I will.
Okay,
Okay, we ready?
we are.
All right, so this is to vote to approve the transfer of operating authority from Northern Dutchess Paramedics to Empress, correct?
Correct.
Okay, so yes, favors to approve that. So, Erin Kelly. Yes. Dennis Wood,
Yes.
Steve Meehan,
You gotta unmute yourself.
Yes.
Brian Terry,
Yes.
Chris Conjero,
Yes.
Dean Romano,
Yes.
Dr. Daly,
Yes.
Alan, Del,
Yes.
me, yes. Jim Stairs,
Yes.
Dale Wingenfelter,
Yes.
Richard Salucci,
Yes.
Anne Marie Cross,
Yes.
Maria Walker,
Yes.
Charles Welch,
Yes.
Adam Fink,
Yes.
Jeremiah Rod,
Yes.
Anand Balazar.
Yes.
Anand?
Yes.
Okay. Anybody I missed?
Steve
That's at a
Cole.
remote-
Okay.
Okay, are you at a remote site, Steve?
No, but I'm present.
Okay, yep, I got you on the present list, yeah, gotcha. Okay, vote passes. Transfers come short.
Carried. The other item that has to be voted on is, so Malaysia Rescue Squad received communications from the New York State Department of Health requesting that they work through the clarification of operating authority process. And that information was submitted to us, also reviewed by the CON committee and deemed to be complete. And I believe Malaysia was going to speak to that.
Steve Meehan should be.
Steve, possibly, yes?
Does the CON committee have any questions for us at all? I guess that was
Yeah.
one question that I had.
No, just for the benefit of the people in attendance, I mean, I think they completed what was appropriate as regards to due diligence, where they much similar to a license application where you reach out to the folks that you serve, request information back from them. And that also involved reaching out to the 911 system that does the dispatch. So I can't imagine there would be anything else that would or should have been done. So as far as I'm concerned, you accomplished what the state would have asked you to do.
What was the purpose of the app?
The language on the operating certificate was vague.
Okay.
So I guess the question is, what's the before and what's the after? I mean, if we're gonna vote on it, do we not know what it's being changed to?
I don't know if this requires a roll call vote or not. I can print up a sheet up real quick.
I don't know, whatever
We
the
need to-
policy says, but I'm
My
just,
understanding was that Steve completed all the paperwork, per DOH's directive. Our CON committee met, reviewed that paperwork, they deemed that paperwork complete. My understanding was that all we need to do is have a Remsco approval that the paperwork was submitted in complete fashion, so. I don't think it requires a roll call, but if you want to be safe.
No,
I
that's
can
fine.
print out the
I don't know what our
fast.
circle is.
Yeah, Tim actually pulled it up.
State-
We've actually had
state
one
recommended,
for quite a
they don't
while. And a checklist associated with it. Moving forward, because as Tim mentioned before we became part of the official meeting, we have another one of these that was recently sent out, and there'll probably be more as, the state is doing its due diligence or whatever to make sure that the writing on the license represents, what's actually occurring. But it's
But I would, What
Policy
I-
says that there should be a motion and a second and vote by the Remsco to accept, modify, or deny the rewarding of the applicant's operating territory.
You say it one more time?
Motion, second, and vote by the Remsco to accept, modify, or deny the rewording of the applicant's operating territory.
I was gonna say, and I'll defer to Steve. I don't think you guys changed anything in your wording. I think you just clarified that the wording on the actual license was correct.
If you're changing the wording on the license, then you're actually changing the license as well.
Yeah.
So other agencies have gone through this. So there's, they're like the northern word end of so-and-so road. So they want actual plot points. So some of these licenses haven't changed since like 1970.
Yeah.
So, well, yeah, but roads have changed. Or, that they go to the river, or it says the northern point of so-and-so farm. Some of these are like little, very outdated.
Yeah. I was gonna say, is that, and I don't have it in front of me, so I apologize for that, but that's why I'm reaching out to you, Steve. Was your process simply to affirm that the wording is correct?
No, because it says
No.
parts of parts of this town. You need to define what the part of the town is that you cover. You can't just,
can you guys hear us here? Can you hear us?
and now.
Yeah.
So I'll clear this up right away. So yes, there's some ambiguity to our overall operating certificate, much like probably most every other operating certificate in the region. I'll speak to the COT process as a little ridiculous. It's evident that this is a policy from 2011 that should very well be updated by New York State to 2026. There was zero help from the state in completing the COT. Quite honestly, what the region has in place as a quote unquote checklist is just a reiteration of the policy statement from 2011. So what I will offer, though, is if any other organization has to go through a COT, don't waste your time in reinventing the wheel. Please reach out to me and I will share with you the documents that I created to be able to complete the process. I made it very clear to the state that I think that this is absolutely ridiculous. I understand where they're going and what they want to accomplish with the information, but not providing any guidance and just leaning on a policy statement from 2011 that's never been enforced was challenging, to say the least.
So I'll make the motion to approve.
Okay. Motion by Dean, second
So
by.
wait a minute, what territory are you approving? What should the CON read?
So in my opinion, there's nothing changing on the CON. Our operating certificate clearly states the entire towns of Kinderhook and Stuyvesant and parts of the towns of Chatham, Ghent, and Stockport. That isn't changing. The back end.
There's the ambiguity.
That ambiguity, unfortunately, unless our operating certificate is going to be a pamphlet that's multi-pages and spelling out all of the parcels that we cover, the portions of those three towns that we cover is not changing. So like I said, it can be concise as a singular page long or, a page certificate, or it can be a stapled packet to label all of that stuff out. But the verbiage on the certificate I don't see how it can change at all because nothing effectively has changed.
So Steve, my question, I guess, would be what now defines those parts that you operate in now? Like, how does whoever dispatches you or responds, or how do you know what your territory is in that town?
Because we use 2026 CAD softwares that are able to pull ESN information of the exact parcels that we cover. I mean, I think much like every other agency, I mean, I think it was difficult for the state to grasp in that our district line didn't correspond with a municipality, a water district, a fire district. I mean, they were lines that were probably drawn in the 60s. Right, wrong, or indifferent, that's what they are, and that's what they have been. And newer CAD systems in this day and age have an ability to be able to segregate that information and plot it appropriately. Again, and I think that's where my frustration came in the entirety of this process, was that okay, the state is enforcing a policy that they've had in place since 2011. Revise that policy, because the information that I had to gather was fairly antiquated. That could get we could streamline this process much easier to be able to accomplish.
So you submitted a map, you had a letter from the.
More than a map. I submitted quite a bit of information.
Among the things you submitted, there was a map.
Correct.
There was also a letter from the county supervisor, along with letters from all those municipalities. But your letter from the supervisor did say all or parts of all of the townships.
Correct. So what the county board of supervisors chair, as well as all of our municipal supervisors who the areas that we cover, they basically just attested in their statement of concurrence that the information that was provided by our 911 center is true and accurate.
Do we have their do we have access to their POD?
Yeah, I think you're looking at.
I think I just forwarded the email to you that you could pull it up, but I'm not sure.
Yeah, I mean, maybe it's, and we can have this as part of a discussion, but as we looked at it as a CON committee, we simply said that if all these people agree and the 911 system and its mapping software is the defining map, for lack of a better description, that there isn't much more we could do, or that the applicant, as far as that they should do, and notwithstanding what your description is, that it would become an addendum that may be multi-pages long if you're trying to describe this without having specific boundaries, whether it's fire district, township, village, whatever. That is your operating authority, and as poor as the description may be, it is what it is, and it's working. I don't know what we would have them do differently.
So
it's the COP, as we call it, the single page document.
Oh, no.
There's
multiple pages from, town supervisors that she just described, the county.
There's a letter, there's the board of supervisors, there's a map, there's statements of concurrence and support from each municipality. There's EMS parcels 2024 from each township. There's, very detailed.
Any dispute by their neighboring agencies?
No.
There's no dispute?
Yeah. No.
Okay, just to reiterate, I'd like to move that we approve this whole thing as written.
I'll second it.
Yeah, I think as long as we have the documentation attached to it that indicates what we're approving right now, that's fine. Because the thing is, the problem is, if you just say parts of, how can that change over time? I'm not trying to be a problem. I just want to make sure as a body, I want to make sure as a body, we're not.
They are?
Because it's still gonna say parts of.
Yeah. I mean, the only thing we're gonna be
They're
able
looking for absolute clarification of where they're allowed to, where their primary operating territory is.
And so,
It said they provided it though. He provided
But he-
the 911.
But he hasn't provided a narrative to go on an operating certificate. It's still going to say parts
Yeah,
of.
but you can't put the whole thing on an operating certificate. It's not
That's
possible.
the exact point.
He provided them with the documentation. If I kind of agree with them. I mean,
I agree, but I know,
So the state's going through all of the COMs, and if they says the northern portion of Saratoga County, they're gonna wanna know what portion of.
and he provided it to them. That's what I'm saying. He gave them the information.
did you
Address.
provide a narrative that said from the
No,
county
I,
line on Route 24 to the corner of, and then east to?
I did much more of the state's job than I thought I needed to do. I provided them, they've got granular ESN information for exact parcels that the county Bureau of Taxation has and real properties that correlates directly with the 911 CAD system. It'd be a book if I'd have to write out this side of the road, this particular parcel over by this birdhouse.
Yeah.
Yeah, no, like I said, this needs to be updated. I can appreciate that the state is hiring mass numbers of individuals and now having to find old policies that we're going to now enforce because we've got a bunch of people that are now hired. But this, just like this, this is very evident that it needs to be updated.
And if I can add here, I think the point that Steve made for us is the definition of an operating authority certificate has changed over time. It's no longer by a boundary that can be described in a paragraph because it's digital data that's in a CAD. So if Steve has provided that data for the state and the state said, okay, this is the data, it's not all going to be printed on the operating certificate anymore. But when the state accepts that change, it will be defined digitally so that if Steve were ever to decide he wants to cover more space, everyone knows what the space he covers is, and he would have to apply for a change. It might not change the words on his operating authority certificate. It would change the digital footprint that all of the involved agencies have agreed is the footprint of the agency.
Exactly. And that's my overarching concern in all of this, and really what I voiced to the individuals that I spoke to at the state level was, we need to not, in my opinion, they need to not hang their hat on a 2011 policy statement. If they want to actually gather this information, we need to get with the times. Nobody is going over to large maps that are hung on the wall to be able to look at crayon marker of where the lines are. I mean, these are 2016, PSAP locations that have this information at their fingertips. This process to be able to do this, it should be a week's worth of time, not months of my time going into this.
Does the CON committee gave the application out to the Remsco, just like the transfer authority? Because we haven't seen it. I haven't seen it.
I thought I sent it. I could send it out, but I mean.
So can we approve something that we haven't seen?
I got it. Yeah, I thought I sent it to
I didn't get
everybody.
the, I didn't.
The transfer authority,
I
yeah,
sent the transfer, but I
or
didn't
the
see
Duchess, but not for this.
Want to send it right now?
And my only point, Steve, Steve Cole, I agree with you. That's kind of what I was saying too. As long as we can memorialize that what we're agreeing to is the documents that were presented with this application. Because, and I'm not saying you're gonna do it, but we need to define what the area is right now that we're approving, because it can change over time if we don't know what it is, if we don't memorialize that we're approving it.
Well, Steve has defined it.
That's what I'm agreeing with you, Steve.
Yeah.
Yeah, go ahead.
Can you add just an addendum pursuant to the map or the CAD effective whatever date? So you're approving the CON and you're referencing these documents as a date of April, whatever today.
I mean, that would essentially
Then
The
you're
motion is
memorialized.
to approve
That's all I wanted.
their
to do,
operating
make sure it's
authority per the submission. And again, I don't know, I mean, I defer to you guys, the challenge is, I guess unless someone else in the state has already done this, is there anything else that, you guys think that they should have done or that we would want to do moving forward?
I
No.
think they've done a tremendous job.
We just call the question to see how we all land on the vote. Does it have to be a unanimous vote?
No.
So I think Steve has explained to us that this is somewhat of a make work exercise to fit a round circle into a square hole.
Yeah.
If the application is acceptable to the state of New York, I think we should feel safe to approve it rather than trying to take a round circle, put it in a square hole, and then add a local trapezoid. Right? If none of the agencies around Steve have objected to this because they think that somehow they're stealing their territory, I think we can just say that the application is complete, if it indeed is complete, and we concur.
Remember that as a clarification of operating territory, the DOH will review and either concur or not concur. And then
What's their job?
we'll issue an amended.
We're gonna send it to them.
certificate.
If they
They take it back, then that's.
Let's send it to them and let it fill at their level, because it's their problem.
I don't think we should cave to their stupidity.
So I second that.
What's the sticking point as it stands right now? That's my question.
I don't think there is a sticking point. I think the point was, what were we voting on? We didn't know what we were voting on.
I think.
Okay, but that seems to be an internal issue. That seems to be an internal issue as it stands right now, because the work was done. The work was submitted to Remo according to the rules. Now we need to figure out whether or not this is going to get approved. That's where we're standing.
It probably will not. I was just asking, my only question was, what were we approving? It still said parts of. I just wanted to know if there had been clarification of parts of. That was the original question before Steve Meehan explained all the things that you guys did. That's all I was asking for. I am not opposed to it. I'm not being controversial or anything else. I just wanted to make sure as a body, we knew what we were doing, because typically when Remsco's vote on anything and it goes to the state and they go, we don't really know what we voted on, we just voted yes, the state has a field day with that. So I just wanted to make sure that we all were in agreement and understanding as to what we were voting on. That was my only.
In my opinion, the voting is really on the supporting documentation. That, like I said, there's nothing that's going to change on face value.
Which I understand none of us had seen.
None of us have seen the supporting.
Seen any supporting documentation.
That's a problem internally. 100%. That should have been disseminated.
That's fine, but that's all we were asking. I just wanted to make sure we weren't just saying, yeah, sure, fine, whatever. But yeah. So the motion, there's a second motion, so I guess
Yeah, but we still don't have the document. So how can we approve something and if we get questioned?
Do you want to jump on my computer and look through it? Because there's about 500 pages.
Yep.
I thought I sent it to everybody. I don't know why certain people got it and other people did not receive it. Art got it. CO committee got it. I don't know why other people didn't. I'm happy to resend it to everybody right now. It'll take you a better part of the day to review it.
You can push it off. I asked for initially when I looked at this, I asked for a year stay and got it. So you can push it off as long as you want. I could care less.
Hey, Steve, one more question. Did this come in conjunction with a agency renewal?
Yes. Yep. So stay tuned, because everybody's going to have it.
I can name at least 2 to 3 other agencies that have been asked for clarification of territory between the 2 regions.
Yeah. And like I said, I don't want to see any other organization or agency administrator have to go through this ridiculousness. So please reach out to me. I'll take my letterhead off of everything and put it onto you. The only thing you're going to have to do is really work diligently with your local PSAP to be able to obtain a vast majority of this information. And then, you're at the will of the politicians to get multiple signatures, which can definitely be time consuming. But don't struggle with this. There is, like I said, virtually no guidance from the state following their own policy statement. And like I said, the Remo checklist that was put in place probably right after the policy statement came out just is a reiteration of the policy statement. It doesn't provide you tangible documents to be able to copy and paste and utilize, so.
This has to be just a simple majority. So can we just call the question, see where we land, and if it fails here at the vote, then we can keep going and belabor this point, but if not, let's just vote on it and get over with, because it really is like redoing colonoscopy over and over again.
Or we can table it until next meeting. But it's not, we don't have to follow CON procedure on this.
Yeah.
We haven't seen the
So
document.
I guess what
What's
I'm
the point of
is
having a CON committee if you don't trust what they have to say to you?
I'm officially asking us to call this
It's a,
motion to a
it's a
vote.
waste of
That's the
time.
end of
That's a
discussion.
great question.
That is exactly it. It ends the
Yeah,
discussion,
it's done.
and I would like to vote.
I mean, we had a committee that reviewed this. It's not like it never got reviewed. We reviewed it, we put it forward, then it was complete. I don't understand what we're arguing about.
We vote.
It's been called to question. So, yes, I believe we vote.
Has the motion been made?
Yeah.
Yes, and yeah, motion was made and seconded.
Let's vote.
We gotta call the vote.
Do you want to do a roll call? Yeah, let's do a roll call. Why not? You have another spot on that one, or do you want to pin the principal?
I can take it off here and I don't think I can describe it. Actually, I'll just do it. I'll do it over here. Okay. Erin Kelly, aye.
Everybody should have to watch them.
Dennis Wood,
Yes.
Steve Meehan.
Absolutely,
Yes.
but yes.
Yeah, I'm getting a yes no matter what. Brian Terry,
Absolutely.
Chris Conjero,
Yes.
Ian Romano,
Yes.
Drew Daly,
Mm-hmm.
good for you.
Yes.
Ellen Bell,
Yes.
Jim Stairs,
Yes.
Dale Lingenfelter,
Yes.
Rich Salucci,
Yes.
Anne Marie Cross,
Yes.
Maria Walker,
Yes.
Charles Welch,
Yes.
Adam Fink,
Yes.
Jeremiah Rod,
Yes.
and the non-vowels are.
Yes.
Okay. It passes.
All right, thank you. Thank you for your discussion, and obviously we'll keep you posted as the state either likes their copious amount of documentation to support essentially what it said, or got to do something different.
Steve Meehan, you should join the systems committee and then set this up as a, as a thing at the state.
This will be now sitting at the Semsco. Yeah, this will probably be one of my first topics to try to
There
see.
you go.
So back to our agenda, previous meeting minutes are recording, excused from today are Lynn Kane, Steve Rutzlaff, and PJ Keeler. And that brings us to executive directors.
Okay, everybody should know, but for the record, we have 3 remote public sites, I cross out tonight. This morning's meeting, Greenport Rescue Squad is live, Scotia Fire is live, and Clifton Park Half Moon is live. Contract payment updates. We did receive the 4th quarter, that's April through June of 24-25 program agency payment in the amount of $88,995, so that's a positive. I was also advised that the Remsco Q1 for 25-26 claim has been approved and processed. But along the same line, I was also advised that everything was on hold due to the budget delay. So I take that as a payment delay. I'm not sure what's gonna happen there. Our paperwork's been submitted, everything's been okay. Let's see when the check arrives. I don't know how one side program agency can say everything's okay, but it's on hold because of the budget delay. Then the Remco side says we've been approved and the process is, we've been approved and processed. So I'm not sure what.
It's the past year's budget. It's
Yeah.
not the one they're approving.
Yeah, so, I mean, we did everything we need to do, it's just gonna be, the check is a mail type thing, I believe, so. Remo Summer EMT starts May 11th, this is a robust class, we have 36 students that registered and paid for the class. To accommodate a large number like that, we actually broke the class into two different cohorts. And for skills and everything else like that, there's going to be a morning session, weekend morning session, and a weekend afternoon session. So we basically split the class in half. Nothing to report from Aram's region. You know, I conclude this. If Beth has anything to throw in there, feel free. EMS award nominations due here June 1. I was in a reminder last week, also with instructions not only to send them to the state portal, but to send them to us. So we have them and I can send them to the awards committee. Our Remo office lease was renewed. We're here for another 7 years. We didn't do that right off the bat. We had relatively exhaustive discussions amongst the executive board. We did procure a commercial broker to see what other sites were out there within this neighborhood and beyond. And actually, some of the sites that we looked at 7 years ago were still on the sheet that broker sent us. The conclusion was, I think we have a pretty good home here, so we re-upped for another 7 years. I thought the terms were favorable. I believe the executive board thought so also. So we're here for another 7. Both the education committee and recruitment and retention committees have met several times. The market analysis, this is one of the things the state wants us to send out, that's i.e. survey, to gauge interest or needs and wants from those respective regions relative to recruitment and retention and education. The education survey was completed and distributed. As of today, 28 agencies have responded to that. The recruitment and retention survey is next. We'll get that out shortly, hopefully. Then the next step is to develop operational plans for both of these initiatives. They are subject to DOH approval. So we'll have to put those on paper, send it to DOH, get thumbs up, and then hopefully move forward. And we have a projected rollout for both of 7/1/26, which coincides with the new contract year. That concludes my report.
Any questions, Ken? Chairperson's report, it'll get covered under the specific agenda item, so I don't have anything from that perspective. Anybody have anything under issue discussions that would cover somewhere else? Medical Director, Dr. Daly.
I'm going to combine this with the REMAC report as well. So REMAC news in concert with our approval today for Empress coming into the region. We approved Jeff Raybridge to operate as their EMS medical director for them in this region. Of note, Dr. Raybridge is actually the president of New York ASAP. So we tend to work with him with some frequency as well, which is good. Other commentaries we had some discussions on were STEMIs and how those cases were working at Albany Med. Some additional conversations, as always, about improving data exchange and getting information back and forth. Hopefully that will continue to improve. And then lots of discussion around CARES, the cardiac arrest registry, and death survival, and how that information will hopefully at some point come through the charting programs rather than just needing to be a secondary guide. It is an incredibly valuable program for us here, as well as across New York State. We need to know how many patients we are saving so we can compare ourselves to others and then get better. We talked a lot about supraglottic airways in particular with the BLS program, and the unnecessary and unreasonable impediments being put between our patients and quality care at the BLS level, and also the additional requirements that are being set for advanced life support agencies who have BLS providers being asked to apply for this process, which never occurred before. This is the first time the state has actually put these impediments in place rather than leaving these decisions on a regional basis. Quite frankly, I'm more than a little bit concerned about the basically usurping of regional control to the state, and I'm not quite sure what ultimately the goal is because it reduces our ability to effectively assure that there are regional systems in place that will provide appropriate care for their patients. One location in particular, Cohoes, has been looking for a significant amount of time now for BLS supraglottic airways. They have had a number of cardiac arrests that would have had drastically different airway management over the course of that time had this program been approved, as we would have done in the past on a regional basis. This is a grave concern. Hopefully this will get straightened out at some point. And that's going to be brought back to the CMAC again. Otherwise, some discussions about pediatric transport. Of note, the biggest study on pediatric transport safety was actually done here. We have seen a significant improvement in pediatric transport safety, but we still need some additional tools in place to take care of neonates in particular. There aren't great ways to move sick, small newborns. I'm not even quite sure what the best answers are, given the stipulations that we have currently for transporting these kids. Well, newborns can be transported in an Aegis rack. Sick newborns, we put them in a neonate, which is a small patient containment device. There isn't a way to keep them warm effectively. We need to build these things out, and ultimately we need to build out regional resources for taking care of these rare but incredibly critical cases. So we've got some people starting to work on that, which I'm looking forward to. We also started talking about new medication that's out there, which you may have seen ads for, which is intranasal epinephrine for anaphylaxis. We were very, very clear at the REMAC that this is not approved for use on ambulances in this region. The only treatment for anaphylaxis with epinephrine is intramuscular administration of epinephrine. That was very, very clear. And then we reviewed some data from WORD, which is our protocol app, which is actually got some interesting background data. Hopefully we continue to see that.
Two notes, we did schedule that pediatric transport class here for June 3rd that Tom Moran does. And anybody who's looked at Muru recently, there seems to have been some big changes.
Thank you, guys.
Any questions for Dr. Dave? PJ is absent. The treasurer's report is here. Is there anything you want to speak to on it?
No, I'm pretty, we're in solid financial shape. Just the delay with the DOH contract payments. We're getting it, we're just getting it a bit late.
Sounds good. Dr. Daly, you want to do the QI thing, or do you think it covered?
It was included in that.
Yep, sounds good. FON, obviously we talked about it. We ran out of order. I would just, from my personal, I think I echo Alan as well, is, I apologize if you guys didn't get that. It was a big document, and we got the two things that we voted on this evening fairly close. So again, I apologize if it didn't get out to you guys. It certainly was not held from you by any stretch. So it's if you didn't get it, it was inadvertent. You should have that. Information from DOH got to be read into the record. So several disciplinary actions. Roswell Sano of Buffalo, New York State EMT number 463218 had their certification suspended for 1 year effective 1/8/26. And they were assessed a civil penalty of $2,000 for violation of Part 800.15B1. Raheem Austin, Lynbrook, New York State EMT number 479837 had their certification revoked effective 1/16/26 for violations of Part 800.3 AM and AP1. Scott Sterling's Prospect, New York State EMT number Probably an error there, but 3223877 had his certification suspended for 1 year effective 2/12/26 for violations of a previously issued stipulation and order. John Gomez, LaGrangeville, New York State EMT number 522594, surrendered his certification effective 2/17/26 for violations of Part 800.3 AM. Course advisories, we don't have anything for the record at this time. Correspondence, and this was actually a little bit ago, but all the members of the current executive board submitted letters of interest stating that they would be interested in continuing to serve in the capacities. And no letters were received from essentially the body if someone else wanted to serve in that capacity. And then we have a letter from Albany County Coordinator Dennis Wood advising that he is appointing County EMS Deputy Chief Robbie McHugh as an alternate for the Albany County Remsco members. So as it relates to that, we would, as a body, accept that and vote to approve him as a member. So if somebody want to make that motion.
We already did that.
Oh, we did it? See, I should pay more attention. I apologize. Committee reports. The only thing I'll say as it relates to the executive is I think Tim understated the amount of interaction and communication that occurred as it related to the lease here. We did, I think, have to work kind of expediently is the best way to describe it, because the proposal from the folks that we currently lease this from, I think we're a little late coming to the table. So we, Tim, did his due diligence to look at alternatives, not only in terms of the physical space, but even exploring, what we could do in terms of other options. But as it related, it I think boiled down to if it ain't broke, don't fix it. This place actually works, and it's worked well for all the time we've been here. So that's why the decision was made to continue as we have. Other than that, I don't think there's anything else under executive finance. Steve? Cool.
I've got nothing to report. State EMS Council, well, I guess a little bit to report. State EMS Council did not meet because of the weather, so the meetings are coming up. The only thing on finance to report is New York State Medicaid is now paying for treat in place. And there has not been any formal guidance issued on how to implement it. If anyone has any questions, they can certainly reach out to me. But the finance committee of the Remsco is going to work on on guidance for EMS agencies at the meetings that are coming up in early May. And we're hoping that the state will put out a Medicaid manual update that explains what can be done. But now most commercial payers are starting to pay for treat in place, and Medicaid that just leaves the only piece of the puzzle being Medicare, which is being worked on by our trade groups at the federal level.
Question. Steve, if the funding is there for the Medicaid treat in place?
It is the answer is yes. Medicaid treat in place is now a Medicaid payable service, just like transport to the hospital. So there's no specific funding that had to be allocated. You're simply putting in place submitting your ALS or BLS, and you're submitting it with a modifier that says it was ALS or BLS without transport, and they're paying it with the same amount of money as if it were a transport, less any mileage component.
Thanks.
So the required HCPCS codes are A0427 for ALS1 emergency, A0429 for BLS emergency, and A0433 for ALS2 emergency. With a mandatory modifier, the second character of the origin destination modifier must be W. And many private insurers are using CPT code A0998.
Can you send that? Do you have that document? Is that document? Can you send it?
Yep.
The some of the commercials are paying not all,
Mhm.
but the Medicaid is a big deal. Even though it's a small fraction, it's a big deal. Medicare.
Well, the other interesting thing, Dean, is that when commercials pay, some of the Medicare Advantage plans that are being managed by commercials use the same payment policies for Medicare Advantage as they do for their commercial population. So some of us actually are getting treat in place payment from for Medicare patients that are enrolled in Medicare Advantage. And nationwide, almost half of the Medicare population is now in Medicare Advantage. And I know there are lots of disadvantages for being a provider in the Medicare Advantage world, but this is one where I'm seeing the payments come and I'm not questioning them. I'm accepting them, and I just think that they're treating their commercial and Medicare Advantage the same, which is treat in place nice.
I think this takes a bit of a cultural shift for us because we have always just written RMAs. And I think you have to start changing providers' thought lines to say an RMA is a don't touch me. Assess with no findings, no transport. And thirdly, assess, treat with interventions and no transport. So you have to write very different PCRs to be able to do this. So that's going to take some internal policy and internal retraining of how PCRs are documented.
The other thing I would encourage to, if I may, I know there are other organizations, legal organizations around that provide information for agencies. We, like many other agencies, utilize PWW, but a number of years ago, they came out with a document that we adopted right off the bat. It's definitely, it does not obviously take the place of good documentation, but it adds to it, an informed decision-making document. Because I think as we can all recognize, the simple RMA is not a thing. But really we're, as healthcare professionals, making a collaborative decision with these patients on what care is appropriate for them. If anybody wants a copy of the document that they have, it's probably on their website, or I'd be happy to share ours with you. But it's definitely, when it's come to training our staff directly, and expressing to them that this document and their further documentation that they complete has those avenues as Beth had described. It's a little bit cleaner from their perspective to kind of see, how this has to be accomplished.
Yeah, I think the RMA and the AMA thing is a category underneath the treat in place because the don't touch me is an assessment, right? Wholly is an assessment. There is complete assessment there, whether, we touch the patient or not. So do you have capacity to make that statement for me to obey you to there's a lot there, right? But there's an assessment. You can't.
There is an assessment. I'll just give you an assessment.
There's an assessment there of whether or not we go forward or not.
From
And with that assessment comes the documentation and liability.
More liability.
Way more liability. So the billing for that AMA, RMA is way more important than realized.
Yeah, the only thing I'll say to that, the document that PWW provides in that informed decision making, it does a good job about separating all of those different categories from a liabilities perspective as well as a billing perspective.
Say it.
Cool. Questions? Good discussion. Undo Lucas.
We're gonna meet in May, but I think probably the biggest thing is that we discussed the restocking agreement about the revision of that. So Beth actually had like a subcommittee meeting that a bunch of us met, and we're waiting for the pharmacies to get back with data. So,
Any questions for Art? Seeing none, PJ is not present, so we'll have a MCI report. Oh, and I jumped. Yeah, so I apologize. So Steve, anything from the EMS Council? Steve Crow, sorry.
Nothing other than Steve Meehan is now our official delegate and will attend his first meeting in about 2 weeks. And the EAMS Memorial, is it May 19th? Is that the right date, Beth?
Yes, I believe so.
EMS Memorial is May 19th. We do have a provider from our region whose name will be going up on the memorial this year. The state is always looking for our region to help fill the plaza with EMS response vehicles. So when the state makes the request, please, as you always do, come. And of course, it'll be an opportunity for us to pay our respects to Kevin one more time, as his name is going to be going up there.
We will also be unveiling the new memorial and a kiosk that tells a little bit more about each honoree up on the memorial.
That remains open. So again, if somebody's interested in serving on that, let them know. Nominating?
We have the letters. Right, Steve?
Excuse me?
We have the letters for
The officer.
officers.
Yes.
So we have to vote on that.
Yeah. They will just do that for their new business. Bullets?
I think Tim covered it in his report.
Good.
Do it by June 1st.
County reports, Albany County? Columbia?
Nothing significant to report.
Greene County? Okay. Rensselaer County?
Think from Rensselaer County.
Saratoga County?
No report.
Good. Schenectady County?
No report.
Excellent. So, the next item would actually be elections, which, we have to do the, due diligence, Robert's Rules of Order. So, I guess we'll start, as we typically do. So, Secretary, the Secretary has indicated that you'd, like to continue in that position. We don't have any other nominations, so the process is to ask if there are any other nominations from the floor. Going once, going twice. Are there any other nominations from the floor for the position of Secretary? Third time. Are there any nominations from the floor for the position of Secretary? And seeing none, you cast one vote for yourself. Is that appropriate? No, would have to be, I'll have Alan do it. So we'll have Alan cast one ballot for Carol as secretary and move on. PJ is, yes, congratulations. PJ is not here to change his interest, so he has expressed interest in continuing as treasurer. So the process again is there anyone who would be interested in serving as treasurer? Those are the things. And second time, is there anyone interested in serving in the position of treasurer? The third time, is there anyone interested in serving in the position of treasurer? Seeing none, we'll have the secretary cast one ballot for PJ Keeler and the job for life, as has been stated in the past by previous treasurers. Next position would be the position of vice president. So we've Alan as vice chair. Vice chair? Yeah. Oh, sorry. Vice chair. Alan has expressed his interest in continuing in that capacity. We haven't received anything from anybody prior to this meeting. So the question is there anyone in attendance who might be interested in serving in that capacity? Second time, is there anyone interested in serving as vice chair? Third, is there anyone in attendance who might be interested in serving as vice chair? So we'll, Carol cast one ballot and, welcome Alan and, you're doing in that capacity. So, yeah, really. Third one is, Chair, that is myself. I expressed an interest in continuing. We didn't receive anything from anybody. So the question to the attendees today, is there anyone interested in serving in that capacity? Once again, is there anyone interested in serving in the capacity as chair? And thirdly, is there anyone interested in serving in the capacity as chair? Seeing none, Carol, submit one ballot. Thank you for your continued support. Any items of full business with somebody? Any items from the floor? The only thing I'll bring up is what we will do, just because it's likely we're going to see more of these, and I'm thinking it's probably going to be an evolving process, is I'll have Tim send out the policy that we adopted as it relates to this clarification of operating territory and also the guidance from the state. And, if we need to make adjustments, we'll certainly do that. And certainly, depending upon what the state tells us as it relates to the application that we just deemed complete, and we'll send off to the state. They may tell us that we need to do something different, but as the groanings at the meeting occurred, probably if you have something that's less than clear on your license, when your license renews, they're going to ask you to, do your own due diligence and send them what documentation they request. So our next meeting would be June 22nd at 2020, June 22nd, again, 10 a.m. Even if we occasionally put evening in there. Again, the 10 a.m. seems to work, and by today's attendance, we did a pretty good job of getting a number of people here today. So that's right and well. If there's nothing else, I'll accept the motion to adjourn.
Jim, there's one thing I think is pretty important. Today was also the RTAC meeting. Art and I have been trying to sort of audit both of these meetings, and I think probably failing miserably at both. We need to do a better job of finding out when other meetings are, because there are a bunch of people who should have been at that RTAC meeting who are here, or should have at least been, been participatory. So we can't schedule things on top of other things.
Well, this was
We just randomly threw all of these. The RTAC meetings aren't going to pay attention to anybody else because they're going 30 counties wide. I have no idea where their schedule is. So we just need to watch, and when we see something like that, we've got to adjust to it. It's going to have to be this group that adjusts, unfortunately.
Yeah, and Remsco voted to set this meeting at this particular time, so I don't know why we have to watch out for other meetings. If Remsco wants to change the time, I understand there's going to be conflicts no matter what with every meeting. So I guess it's up to the body here to decide what you want to do. So there aren't future conflicts, but I don't know exactly how you accomplish that.
We had this exact conversation when we made this change. We had this exact about that meeting, and for whatever reason, you're supposed to do it anyway. I agree. We probably should have.
I don't remember that conversation.
The whole group. I think you were the one brought it, or maybe Art brought it up. It's like, this is the date of the RTAC too.
I think Art brought it up because I don't believe I was at the last meeting.
I know somebody brought it
So-
up, and so, but we, for whatever reason, I don't think it was a good choice, but we did choose to do it anyway.
So I'd like to point out to the chair, okay, that participation in the RTAC, right, is key. Tim needs to be on that call, right? Carol needs to be on that call. Art needs to be on the call. I need to be on the call, and I'm sure other people here should have been. Right now, they're talking about a couple of really salient pre-hospital things that are pertinent to EMS in this region, and our sister regions local to us.
Yeah.
We should be there.
Is that, and for clarification or just for the benefit of everybody here, is that, what's the frequency and what's the frequency of the conflict?
They're
Is it-
quarterly, right?
Yes.
So is it that we only in the course of the 12-month period, do we only
We're gonna have to.
conflict
four
with
times.
one?
No, well,
No, because we don't meet every month.
we don't meet every month and I
So it'll
don't
be
think theirs
twice.
is done. Is
Yeah.
the same.
Which will be
kind of
50% of their.
range of fourth
Which will be.
So I think what we need to do though is if it comes out that there's a conflict, we have to look at what are we gonna, how's it gonna impact quorum? Because today, I think we all made the choice to be here because of the.
Yeah, because
The
of the
vote
vote.
that needed to be done, but I think in the future, it may be, well, we're gonna defer to this other meeting and maybe miss out on this one, so I think we'll have to look at, and going for other meetings as well, I think it would make sense to see how many people are impacted, so that we don't,
Yeah,
risk a quorum for this meeting.
Yeah, and I would say we'll definitely take a look at that between now and the next meeting and address the conflicts, because I would echo what Dr. Young said, and that is that, you know, and we just use him as an example, but his participation in the meeting and this meeting are both critically important, so we don't want to put them in the position of having to do what they're doing.
And McHugh is presenting on this one, right?
Yeah.
Right, so it's just.
So I think I would suggest though that the move from the night to the day was a good move. I think this is just like some growing pains. Maybe we need to consider, is it Monday morning? Maybe it needs to be a Tuesday morning or something different, but I think that
There is no conflict for June, October, or June, September, October, because the RTEC meeting in November 2nd is 8:00 and we don't have a meeting that day. I'm trying to find the other meetings.
And just so you know, that the case they're discussing right now is a traumatic arrest reversal that went to an outside hospital, kept on rearresting, ended up being put into an aircraft and transported to the Med. Pretty pertinent for folks to engage, well engaged.
I think based on what she's saying, it's not really that big of an issue. What's the biggest issue I think would be involved is what is involved in changing a public meeting time? You know, who do you have to tell if the time is changed by 1 hour, either here or there? If it's only gonna happen once or twice a year, I don't think we reinvent the entire wheel once again to change this. I think we can simply alter the start time of this meeting.
Yeah, I mean, and in defense of the process, I don't think we knew that this was a oopsie until maybe 2 weeks before. So it was just how or what we should do. And again, I interacted with Dr. Daly. I wasn't aware that all of you were other guys participating in that meeting. And I think it's important to have that opportunity available without having to decide where your head is going to be at, even if you're trying to follow it on, digital attendance. So yeah, we can certainly do that. And from what you're telling me, it's not a huge.
I'm only seeing this conflict so far, but I will work with Krista McCullough to see what other dates she has got outlined for our TAC.
Robin Boyles now.
Pardon?
Robin Boyles is the contact now?
Is it? Okay, thank you.
Huh? Oh, yes. This is supposed to get a motion and she's going to be staying.
Well, if nothing else. Go with the motion to adjourn.
Motion we adjourn.
Got a motion, second. Anyone want to vote no or abstain? We'll call it approved, and thank you all for attending and being part of the quorum. So, participation, that's huge.
Or did you think section 4 if you have your safety pocket on them?
Yes, I forgot who sent it, but somebody did send